A couple of years ago, we had a report back from city staff where we actually asked the question, how much does addiction and homelessness cost the city of Vancouver? And we were finding that the city of Vancouver is spending somewhere around $27 million per year on the various programs.
Well, the street use of heroin carries considerable costs with it. I mean, there are costs to the individual in terms of sickness and in ill health.
They're doing it because of the black market in back alleys with shared needles. That puts them at risk of HIV/AIDS, Hepatitis C, bacterial infections, abscesses in the heart.
They're quite frequent visitors to the emergency rooms and the inpatient beds of hospitals in the inner cities. Then there are significant costs to society in terms of sort of public disorder, where the public spaces become compromised by injection drug use, used equipment, discarded needles and syringes.
Whether it was for housing, policing costs, needle sweeps, it's all been bundled together. Engineering, for example, just cleaning up the streets, things like that costs a lot of money. And so clearly, we can save a lot of money in the city of Vancouver by really tackling this problem.
They also, for example, have to acquire the money to pay for heroin, and that often leads to criminal activity, to women having to sell their bodies for sex work, and so on.
So for the city of Vancouver, it's a substantial cost, and by taking care of folks, we can reduce it a lot.